Hi, it's Dr. Rian Maercks, the Maercks Institute. And we get a lot of questions about what's going on with this concept called the microlift and the hybrid micro lift. So I want to take a minute to explain that to you guys. What's going on when we're showing these pictures of patients, pretty radical transformations, going about their normal lives in a day or two like this patient. Well, this technique is really the evolution of my facelift technique over the past close to decade and a half, where I've been in the past a proponent of deep smash lifts, supporting the deep structure of the face on every patient. And really a few years in my practice, I took a deep dive quite literally into the composite facelift. And I'm a big proponent to this day of composite facelifts. It's a go-to facelift for suspending the entire face. But what's happened in the world is people are scared of facelifts. There's all kinds of doctors promising all kinds of results that get quite famous with marketing that create bizarre or non-humanoid results, stretched out faces, all these things people are scared of. People hear about nerve damage, all this stuff. So the public in general has veered away from composite deep plane facelifts. I still do a bunch of composite deep plane facelifts in my practice for the right patients. But in general, patients aren't as hungry for that. And one other thing has happened. People at a younger age have become very interested in refining the lower third of their face and making sure their neckline looks amazing. So that's where the microlift concept comes in. About a decade ago, I developed a concept called the MAERCKS lift, which stands for my last name, but stands for musculoaponeurotic, the muscular structure system, retention with check kite suspension. That means that I started refining something in between a deep plane composite facelift and a smash lift, only elevating what's necessary to support the different points of the face and the smash, the deep tissue, to get a very natural looking result with minimal downtime, minimal recovery. So just focus the section, what I call histiocentric techniques, tissue focus, to get the best result, the best impact, and the quickest surgery that causes the minimal insult, minimal risk of injury to structures, and just great results. So the histiocentric kind of check kite suspension component, when applied to the neck, became the foundation for what's now called the microlift in my practice. And that means with the innovations of handling the neck and platysma, a lot of great surgeons in the past decade have really refined this by creating flaps where they completely transect the platysma, lift it, make like little kite suspensions, much like my original concept. And over time and experience, I developed a way to access the platysma without extreme dissection, without taking it apart, and really suspending it aggressively. And so the important thing to realize with the microlift is it is not a cheat or a shortcut facelift. Most facelifts, like smart lifts, quick lifts, all this stuff, mini facelifts are usually skin-only facelifts, usually, not always, under-trained practitioners that don't understand facial anatomy and complex facial aesthetics are doing a skin-only facelift. They're cutting out some skin around the ears and sewing together, which leads to pixie ear deformity, a horrible scar, usually malpositioned, tragal retraction, all the telltale signs of facelift, pixie ear deformity. This is not what a microlift is. A microlift is the same exact lift I will use in a $100,000 facial rejuvenation, where we do all the things, but focused on the neck, which is the primary concern of most people. So what I do is I dissect out and find, as I'll show you here, a little picture of the platysmal muscle. So this is the platysma. This is the muscle that goes to the lower third of our face and throughout our neck. And what I do in a microlift is a very tailored manner of accessing the anterior platysma in a very specific place to redefine the cervical mental angle. That's the angle between the neck and the jawline. So I find a correct spot here of the platysma and create a minimal dissection check kite flap, which allows me to make this muscle, which is banding together and getting ugly and causing crepey skin, to suspend it all the way back behind the ear without doing a full facelift dissection. Because I never enter the face and I just access the key area for the platysma, I'm able to create these dramatic lower third result, suspend everything from the clavicle up, because that's what the platysma controls, create these great results without doing a typical facelift, without having recovery. This allows patients to go out to the same night, which sounds bizarre to people, but that's how it works. So let's go back and look at some results. So these are some results that we pushed before. We get a lot of questions on. These are very early results. As you can see, this patient is another patient that was really bothered by, you can't see her clavicle, everything but clavicle up, really troubling her with this crepey skin, the multiple wrinkles, the multiple redundant chin bags here, and the poorly defined chin. So with the microlift, which this is early on, this disappears completely. You can see there's a natural fold in front of the ear. When this heals, this looks exactly the same. Really, there's no telltale signs of a facelift at all. There are no scars to be seen. And this is an early result a few days out. This patient's here to show you that we use the same exact technique even in more advanced surgery. So this patient not only had the microlifting technique of the neck, but I moved his chin bone forward, a genioplasty. Extremely powerful because as an anterior pull, which we create the anchoring port of the muscles goes forward with the bone, and then the microlift technique anchors that platysma. Look, as Adam's apple. You couldn't see it buried in there. And this is not a liposuction technique. This is a direct technique where we go in the neck, tighten up the neck along with the microlift and move the chin forward. This is another patient where we did a similar technique. Had a retrusive chin, move the chin forward slightly, and just a microlift. So this is only moving the bone forward and doing the microlift to get that platysmal suspension. You can see all these wrinkles here, all this loose skin, all supported up through a microlift technique without having that facelift recovery. Another patient who did not want a facelift and had this very short, the picture's a little deceiving. Look at this little short jawline. If we compare that to here, we've almost doubled the jawline here just with the microlift. And this patient, indeed, same night was out to dinner like nothing happened. And that's really one of the beautiful things about the microlift technique. When a patient can afford more recovery, has more midfacial findings, and wants to go through the additional expense, we do perform the deep plane composite facelift, and I love it. But most patients are really opting for this. And this is a neck lift for patients that will not tolerate a surgical neck lift. It's kind of like the magic pill neck lift. This patient actually had a facelift. This is her facelift result. Obviously, she was very disappointed at an outside practice. She said, there's no way I'm ever having a facelift again. Her recovery was not fun, and she was left with a result pretty similar to where she started. So we did a facelift revision with just a microlift and an extended, she had the scar up there, so we extended it. But you can see in a quick, short recovery, almost no recovery, we're able to redefine this jawline, this jowling, and this excess skin with a microlift technique. That's back to that patient. This is a patient really young. This is a patient I would never do a facelift in, that kind of wanted this poorly defined jawline. See, she has no jawline, a little hanging skin here, but really just wanted that lower third tight and then neckline improved. And you can see it's subtle, but the neckline looks a lot better. And while her jawline definition stops here, it goes all the way a little cut off, but you can see it keeps going all the way back. And even her mandibular angle shines through, and a lot of young people are looking for this. So it's a kind of neck lift that's appropriate even for very young people. And then if we go back to our whatever recent Instagram posts, you can see this is just a 2-day and 5-day result. But this patient exemplifies what we call the hybrid micro vol lift. So what that means is this is a patient, there'll be nothing wrong with doing a composite facelift, full facelift of this patient. But again, this patient doesn't want to deal with recovery. She went to a dinner party 2 days after surgery. So we handled the periorbital area on the eye and the upper third of the face with what I call aesthetic facial balancing. That means a 10 or 15 minute treatment with fillers to create the heavy lifting that a facelift would need to do in the mid cheek. You can see her cheek, the light reflex of the flash is way down here. That's the point of maximal projection of her face. And then it's elevated. So that's because the volume up here creates that supported malar eminence, or the supported cheek up high in a natural way, that she actually looks skinnier here than she did here. And the lower third of the face, from the clavicle up, you can see from the clavicle up, this is all not so nice skin with lots of wrinkles. And we see now it's all nice and smooth and very poorly pronounced jawline with multiple folds, nice clean line. And this is, again, 2 days later, she was out at a dinner party enjoying life. So I hope that answers some of the questions of the microlift. And most importantly, I like to differentiate the microlift from other things that sound like it, like a mini lift, a quick facelift. Most no downtime facelifts or abbreviated facelifts are skin lifts. That means you're putting the skin together and create deformities over time. Never really give a great result. The microlift is different in that it's exact same handling of the lower third of the face and neck that I do in the most expensive, most complex facelifts out there. If you have more questions, please contact us. We'd love to help out and take care of and provide you with anywhere from aesthetic facial balancing to a microlift to a full composite facelift. And we can help sort out what's best for you in your individual situation with your anatomic findings, your physical needs, and your constraints as far as downtime, recovery, and finances. All these things go into play. There's not one facelift that's right for everyone, but facelift that's right for most people these days is, in my practice, the microlift combined with AFB, the micro hybrid ball lift. One of those two is the thing I do most these days, and I'd be happy to teach more about it. Thanks.